everyone to a special edition of The Doctors. We have a waiting room full of patients here with us today who need answers, and we're here to help out each and every one of them. From painful toes and random rashes to a not-so-pretty smile. We're covering it all today in what we're calling the Doctors Medical Center. And here to help, we've invited in some specialists. Dr. Will Kirby, Dr. Jen Berman, and Dr. Karen Sierra to the show. Thank you all for hanging out with me today.
This is great. Exciting.
Happy to be here. So obviously throughout the show we're going to talk about various issues, and luckily you are all specialists here to help us out. But we receive thousands of emails each week from our viewers, so let's go ahead and answer a few. This is an email we received from June in Atlanta, Georgia. She writes, "Dear doctors, for a couple days, I've had sudden pain when chewing and a little sensitivity to cold and hot foods. At first, I thought it would go away on its own, but the pain feels like it's getting worse. Should I go to the ER or just make an appointment with my dentist?" And I'm so happy that we're talking about this, Karen, because people don't realize there are almost 1 million visits a year to emergency departments for dental problems.
I'm sure you've seen a lot of dental cases coming in through your emergency room, haven't you?
I see way more dental, I'll call them emergencies because people think they're emergencies, than I ever predicted. I didn't go into emergency medicine to be a dentist, and yet I've had to learn a lot about it because people don't know.
Well, and the reason is that you have all these patients procrastinating because they're so fearful of going to the dentist. And for example, this particular patient that emailed us, to me it sounds like a fractured or broken tooth. Now, the most important thing is that you need to take care of this immediately. So many people procrastinate because they're so scared of coming to visit us at the dental office. And what they don't realize, by procrastinating, they're actually will lead to more extensive and more expensive dental procedures later on.
Once there's pain, and I understand, I'm one of the ones that avoid the dentist, I hate to say, but once there's pain, what does that mean? Does that mean that the nerve is exposed?
Well, it could necessarily, not necessarily will it mean that the nerve is exposed, but it could be that it is being affected.
Or infection.
And it may lead to an infection, and it may lead to a root canal, and sometimes when the tooth is fractured, you have to remember that sometimes you cannot visibly see these cracks.
People need to understand this. The reason there are so many emergency department visits is oftentimes it is because people can't afford going to the dentist, or maybe it's midnight on a Saturday night. So when you're talking about a cracked tooth, once you expose the nerve, it is incredibly painful. Let's talk about some things people can do at home if that happens to temporize, because in the emergency department you can do injections that maybe last for 10, 12 hours, but the fact of the matter is you need a dental procedure, and as an emergency medicine physician, I am not qualified to pull your teeth out. I can help with abscesses, I can help with things of that nature, but what could I do at home to temporize if I do crack a tooth?
There are some materials that they sell at pharmacies which are basically like these temporary cements that you can help to put it away. But like I said, sometimes it's not necessarily crazy glue.
Do you ever see people who crack their tooth and try to glue it in themselves? I'm sure you've seen that.
Well, if you actually lose your tooth, the best thing to do is to reimplant it, and it will potentially live and survive.
Actually soak it in a little bit of milk.
Okay.
And that will help prolong it if you can see the dentist the same day.
And if the whole tooth falls out?
If the whole tooth falls out, literally you can just stick it back in and just hold it. You don't want to be eating on corn on the cob the same day.
And the benefit of that would be to allow you to eat or to prevent an infection or to...
And to basically replant it. The periodontal fibers, which are the fibers that hold the tooth in place, will actually can reattach. It's a 50-50 chance of it saving it.
To have that tooth hanging out while you're going to get help? Your mouth. So if if it's assuming it's clean. But I think the takeaway here really should be that if you are not getting regular dental care, and especially if you can't afford it, research free dental clinics in your area. Luckily, most communities will have free dental clinics, because if you wait until you fracture your tooth, that pain is debilitating.
I've literally seen grown men cry and bend down, onto their knees. And the thing is that if they think that dental visits will be expensive if you're just going proactively, imagine how much more expensive it is if you need a root canal, or if you need the tooth extracted, then you need an implant placed, then you need a crown.
It's like preventative medicine. We have to be preventative with our teeth as well.
Yes.
And the reason to go to the ER is when you talk about oral problems, if you have a big abscess that's starting to potentially push your tongue to one side of your mouth, you're having any concerns about breathing, that's when it's a true medical emergency and you should get help. Well, let's move on to another email. This one comes from Mark in Salem, Oregon, and he writes, "Doctors, I have a sharp pain in one of my testicles. When this happens, does it mean I need emergency medical attention?"
Doctor, I'm going to give you that answer.
It means for me, if I have that, I go right to the ER.
The issue with this question is if it's intermittent. So coming and going, there's something called intermittent torsion. So it'll come and then it'll go away and the guy will think like, whew, everything's okay. You have to get that checked out. A sharp stabbing pain, that sporadically hits, that could be any number of things, but it is something that you want to take seriously. The good news is that cancer or tumors are usually, in terms of this, are usually painless. So if you're having pain, don't immediately, freak out and think that it's a tumor.
Now, can a man actually untwist his own testicle?
Yes,
it can. It can spontaneously untwist.
I'm wondering because I don't know.
The fact that it needs to be done, it's not easy because it's hard to tell which way. And sometimes multiple.
You can twist it probably a little more if you twist it
the wrong way. If it's already hurting, don't go the wrong direction.
The first thing you might try if you sought medical attention is the physician might try to untwist. It's almost like opening a book.
That's what you hear, is that you want to look at it face on and open it like a book.
So the one thing, Jim, with this question, men experience intermittent testicular pain. Sometimes it's no big deal. Obviously, there are infections that can cause it. But I think the takeaway is if you get testicular pain out of nowhere and it's a fairly significant severity, you probably want to get it checked out. But testicular torsion also usually just happens in younger men, right?
It's generally more common in younger men or men that have some sort of, or children that have had some sort of congenital or anatomic change. Sometimes after playing sports or trauma or unusual acrobatic activity perhaps that you may have engaged in, that can cause.
So, now that we're in our 40s, we're good.
I mean, if I have the slightest tweak, I'm calling you. But
I have Jen on speed dial just in case.
But do your testicular exams, guys.
Absolutely.
Both of you. For the non-painful issues.
Right.
Okay?
And they give men 2 testicles so you can mess up once but not twice. All right, our last question is from Jake in Boston, Massachusetts. He writes, "Dear doctors, my wife recently had a bad sunburn where it was extremely red, painful, even had blisters. If this happens again, at what point should I call a doctor or take her to the ER?" They call sunburns because it's a burn.
It really is. It can be very, very severe. And also, let's preface this discussion by saying a sunburn at this day and age is ridiculous. You have to plan ahead, and it's not hard to put on SPF clothing or creams, lotions, or sprays prior to going to the beach. But there are some real things you can do to prevent a sunburn, or at least treat a sunburn when it occurs, and let's acknowledge that it does happen occasionally. One thing I tell all my patients when they have a sunburn is immediately take 2 aspirins, and there's a reason why. 325 milligrams of aspirin every 6 hours has been shown to decrease prostaglandins, and sunburns are mediated by prostaglandins. So it's incredibly imperative that you start that right away as long as you don't have any contraindication from taking aspirin. I also like people to use a cool compress or take a cool bath. And then one of the last tips I have, if you can't go to the doctor, you can't go to the ER, is to use 1% over-the-counter hydrocortisone cream, which is an anti-itch cream or a hemorrhoid cream, because it's a steroid and it'll remove inflammation.
And this really applies for parents out there with your kids, because it's the sunburns that occur when your children are young that will lead to cancer later in life, and it takes one bad sunburn to really up your risk.
Dr. Travis, I think it is paramount to child abuse, or at least child neglect, if you're letting your kids go outside and get blistering sunburns. That's just terrible parenting. It's no different than not making your kids brush their teeth. They're children, and if they're under 18 years of age, you have to tell them what to do. Make sure your kids are using sun protection.
Let me ask you this, as a mother and a parent, because with the kids and you're at the beach and they're in and they're out and they're out of the What sunscreen do you recommend, and how often do we have to apply it?
This is such a common question I get, and I tell people the best thing is barrier protection. Waterproof shirts, waterproof hats. It's the single best thing you can do, and even a hyperactive 2-year-old like I have.
They go up to there, and then you have the face.
Long sleeve, well, then you put on a zinc oxide or a titanium dioxide-based paste.
But before we go to break, you know, Will, I just think you're being a bit hypocritical because it's obvious you spend a lot of time suntanning. Well, you know, every time we have a dermatologist on the show, I feel guilty if I have any color at all because it's so obvious that you put...
Well, I'll tell you what, I'm actually the
I should?
You should feel guilty.
I wear sunscreen, but I still get sun. I can't help it.
I'll tell you this story, and the honest-to-God truth, when I was 29 years old, I had skin cancer on my leg, and I had surgery because I used to live in Miami, and I used to go to the beach, and on my way home from the beach, I hit the tanning salon, and I was as tan as you've ever seen, and I regret it now every single day.
I have a great secret tanning spray. It works. You know, you just spray it on, and I could look like I live in Miami.
Right now?
I do.
And I can't rub it off?
No,
I have it on my leg.
You both have a really nice color
That's
to you.
spray tan,
This
baby.
is all make-believe, and I'm actually not as tan as I normally am, I must admit.
Well, I think one thing that I will say when I look at you and I think, okay, you probably haven't had any sun on your face in 10 years.
Okay, yeah.
That's a youthful-looking 40 right
I'm
there,
looking
isn't
good
it?
for 40, right?
Thank you. That's all right. He knows a thing or two about his skin. Well, you all game for sticking around?
I'm ready.
Well, coming up, if you feel like you made a huge mistake getting that tattoo, you don't want to miss the next solution. Stick around.